Good afternoon. My name is Kathy Hickey, and I'm the project coordinator for Mass Family Voices, a project of the Federation for Children with Special Needs. Welcome to Mass Family Voices webinar entitled Health Insurance Appeals Process. We're so glad you are able to join us. I'd like to give you a little background on the Federation for those of you who are new to us. The Federation for Children with Special Needs started in 1974 by a group of parents who were part of a coalition that pushed to get the first special education law in the country passed. The Federation provides information, support, and training to families whose children have special needs, special health care needs, and children who are at risk culturally, linguistically, or economically. Helping families access and advocate for quality health care for their children with special health care needs is just one of the Federation's many projects. I will be facilitating the webinar today. This webinar will be recorded and archived at a later date on the Federation's website. A few technical pointers. Please be advised that everyone will be muted except our presenter. If you have any questions, please use the webinar toolbox that allows you to type in questions, and we will answer them either during the presentation or I will collect them for the question and answer portion of this webinar, which will follow the presentation. Our webinar today will be presented by Jenifer Bosco, the Director of Office of Patient Protection at the Massachusetts Health Policy Commission. Welcome, Jenifer. And thank you to our IT Director, John Sullivan.
Hi, thank you, Kathy. So, as Kathy said, my name is Jenifer Bosco. I'm the Director of the Office of Patient Protection, and I'm going to start out with an overview of the Office of Patient Protection and what our responsibilities are. I'll move into describing health insurance appeal rights for consumers. And then I'll talk a bit about insurance open enrollment waivers for people who want to purchase non-group health insurance outside of the state enrollment periods. And we'll build in time for questions, so you can please feel free to type in questions as we go along. So I'll start out talking about the Office of Patient Protection. We are an office within the Massachusetts Health Policy Commission, and the Office of Patient Protection was originally created as part of Chapter 141, the Massachusetts Managed Care Protection Law, and the office was created in 2000 within the Department of Public Health at that time, and it established consumer appeal rights to challenge health plan insurance coverage denials, and this is a process that applies to Massachusetts fully insured health plans only, and I'll talk a little more later about what that means. So the Office of Patient Protection, or OPP, had operated within the Department of Public Health for a number of years, and then in 2012 the state passed Chapter 224, which is the Massachusetts Healthcare Cost Containment Law, which did a number of things to try to reduce healthcare costs and keep healthcare costs sustainable in Massachusetts. And one of the things that the law did was move the Office of Patient Protection from the Department of Health to a new agency, the Health Policy Commission. So that transfer happened on April 20th, 2013. And the Office of Patient Protection has been operating within the HPC since that time. So the Office of Patient Protection has a number of responsibilities under Massachusetts law. It was created to regulate the internal review process for healthcare consumers who have health insurance through fully insured health plans, and also to regulate and run an external appeals process, and I will describe those more on the next slide. The office also provides consumer assistance and education. We have an 800 number that people can call. We have information about health insurance on our website, and we also have an email address that people can write to with questions. That contact information is all going to be part of this presentation as well. We administer enrollment waivers, as I'd mentioned, for people who want to purchase their own health insurance outside of the open enrollment periods. We receive annual reports from Massachusetts health insurance companies, and they need to file reports annually with the Office of Patient Protection about the number of member grievances, which are member complaints that they receive, about the number of those that go on to a second level of appeal or external review and the outcomes of those. They need to report information about their provider networks and the number or percentage of providers within their networks who've been disenrolled and the reasons why. They also need to report information about quality of care measures and the medical loss ratio, which is the percentage of money that the insurance companies spend on actually providing health care as opposed to administrative costs. And one newer area that was part of Chapter 224, the Office of Patient Protection, is also in the process of developing an appeals process for patients who receive their care from providers who are in risk-bearing provider organizations. So first I'll talk about health insurance appeal rights for consumers, and this is the main area that the Office of Patient Protection works in. So if you're a consumer in Massachusetts and you have a fully insured health plan, then your appeal rights are regulated by this office. And so, what's a fully insured health plan? There generally are two types of health insurance. There are fully insured plans and self-insured plans. So if you have a fully insured insurance plan, that means it's a traditional insurance policy where your employer, most likely, if you have insurance through your employer purchases the insurance plan from the insurance company and they pay a set amount per month as their premium. So you might contribute toward that as an employee. There might be an employee contribution that's taken out of your paycheck, but there's a fixed amount that's paid every month for the health insurance plan, and the insurance company then bears the risk of paying out those claims. That type of plan can be regulated by the states. There's another type of plan called self-insured, and you tend to find those with larger companies or companies that have locations in more than one state. And that's where, instead of a traditional insurance plan, the employer decides, we are big enough that we're going to bear the risk of paying out those claims ourselves. So the employer is actually the insurer. The employer is paying the health care costs of the employees. The employer is paying the claims, but they typically hire an insurance company to administer that plan and to handle the paperwork. So the employee, if you're an employee and you have a Blue Cross card or, Harvard Pilgrim or any insurance company, you wouldn't necessarily know if that is a fully insured or self-insured plan. If you want to know that, you would look at your plan documents or ask your HR department to find out. So generally in Massachusetts, there's, I think, about half the population who has commercial insurance has fully insured and half has self-insured plans at this point. So anyway, going back to the internal appeals process, what I'm going to talk about primarily applies to fully insured plans, although if you do have a self-insured plan, you likely have very similar rights to this. So if you are, if you have a commercial health insurance plan and you and your provider believe that you need a certain type of service, like physical therapy or inpatient mental health treatment or a type of surgery, a type of medication, some kind of healthcare service, that claim or that request for prior authorization is sent to the insurance company, and the insurance company decides whether that's something that needs to be covered or not. They're only required by law to cover things that are mandated benefits in Massachusetts, federal mandated benefits, things that are listed in their plan as covered benefits, and things that are medically necessary. So your plan is going to make a determination about whether the treatment is actually a covered benefit and whether it's medically necessary. So if you're a consumer who's been denied coverage for treatment, or you have another dispute with the insurance company, then you have a right to file a verbal or a written member grievance, also called an internal review or internal appeal, and you file that directly with the insurance carrier. The Office of Patient Protection regulates this process, so we write the rules around this process, we monitor the outcomes, and we field complaints about this process. So if you're a member of a health plan and you have a complaint, or if you're disputing a claim decision, you generally get a denial letter from your insurance company, and then it will tell you how long you have to dispute the claim or file a member grievance. So you would either in writing or by phone file a grievance directly with the plan. If you file the grievance over the phone, then the insurance company has to put it in writing for you and send you a copy. So the carrier, the insurance company, generally has 30 days to respond to a grievance, although an expedited grievance is possible if it's treatment that's urgently needed. Then the decision has to be made more quickly, within 48 or 72 hours. And if it's a standard grievance where the carrier has 30 days to respond, they also may ask you to agree to give them a little bit more time if they need additional time to collect medical records or review your case, and so that is a voluntary decision for the health insurance consumer. You can agree to give the insurance company more time or not. If it's an urgently needed medical service or behavioral health service and your doctor feels that there's a substantial risk if you go without that service during the appeals process, then you and your doctor can ask the insurance company for continuation of coverage so that they continue to pay for the treatment while the grievance is being decided. So when the insurance company makes a decision about your grievance, they will give you something in writing, a written denial letter, which is also called, under the law, a final adverse determination. And they'll provide you with a notice about any other appeal rights that you have, external review rights, through Office of Patient Protection or elsewhere if you have a different type of plan. So at that point, if the insurance company has denied your internal review because they believe that the care isn't medically necessary, you may have further appeal rights through the Office of Patient Protection. And you also see on this slide I have some information about the internal grievances that were filed during 2012. We're in the process of putting together the 2013 information now. So in 2012, carriers reported receiving over 12,000 grievances from healthcare consumers, and those could have been a wide range of complaints, either claims that were denied or billing disputes, or possibly issues with healthcare providers. And almost half of those were resolved in favor of consumers by the insurance companies. So if you go through the internal review process and the insurance company reviews the claim and they decide, okay, we should cover that, then you're all set. You don't have to go any further and your care will be covered. But if the insurance company reviews your claim and decides that they still believe that the care is not medically necessary, then you do have further appeal rights if you have a fully insured plan through the Office of Patient Protection. And the next level of appeal is called an external review or an external appeal. So if after the internal review, if the insurance carrier still does not cover the treatment and it's based on medical necessity, then the consumer does have the right to an external appeal for eligible claims. At this point, the Office of Patient Protection, our role is we also regulate this, so we write the rules around external review and we run the process. So if you file an external review, you're actually sending it to the Office of Patient Protection. Once a consumer receives that letter from the insurance company, the final adverse determination, then the consumer has 4 months to request an external review. That's 4 months from the day that the consumer receives that notice, not from the day it's mailed. So there is a standard review where you can file the external review request and you will get a decision within 45 days after that's sent to the external review agency. But if it's an urgent medical need, then there's a quicker process where you can get a decision within 72 hours after that case is sent to the external review agency. There's also a provision for continuation of coverage for urgently needed care. So if an individual is, say they are inpatient at a hospital and they're receiving treatment and then they receive a denial notice from the insurance company saying that the insurance company no longer believes they need to be treated in the hospital, then the consumer can request continuation of coverage during the appeal if within 2 days after the day when they receive that denial notice, if they ask for continuation of coverage. and state that this is urgently needed care. For a consumer who is filing an expedited review, they actually don't have to wait to get the final adverse determination letter. So when the consumer first gets a denial from the insurance company, you could choose to either first pursue expedited internal review and then expedited external review, or to do both at the same time. That's up to the consumer as well. So when the Office of Patient Protection receives an external review request, we review it internally to see if it's eligible. So to see if it's a fully insured plan, if it's within the time frame, if it is a covered benefit. Sometimes we do receive insurance appeal requests that are sent to us sort of accidentally, where it might be a self-insured plan and there are different appeal rights, or it might be another state that the person has to appeal to, it's not a Massachusetts plan. So we review for eligibility, and then when we determine that the request is eligible, we don't make the decision ourselves about whether the care is medically necessary. We contract with medical experts who make that decision. So we contract with 3 external review agencies. One is in New York, one is in Pennsylvania, and one is in Utah, but they have doctors and other healthcare professionals on their panels who are all over the country. And the cases are sent to those external review agencies on a random basis. The external review agency then looks at the case and assigns it to a medical reviewer who works within the same specialty. So if it's cardiac care, it would go to a cardiologist. If it's substance abuse treatment, it would likely go to a psychiatrist with experience in addiction treatment. So the reviewer then looks at the medical records, and for a person who's filing an appeal, they don't necessarily have to send in all the medical records. If you're filing an appeal, you can send whatever information you would like, but the medical records generally are obtained from the insurance company and from the provider directly, so it's not something that the consumer has to do themselves generally. So the medical reviewer will look at all that information and will make their own independent decision about whether care is medically necessary or not. And if the reviewer decides that, yes, this is medically necessary treatment, then the insurance company has to abide by that and has to pay for the treatment. And the insurance company also has to respond within 5 days to the consumer, within 5 days of receiving that decision. So in 2012, we received close to 400 requests from external review, and close to 300 of those were actually eligible requests. And then you see here in this chart a breakdown of what happened with those. So usually between 30 to 45% of cases are resolved fully or partially in favor of the consumer, and that was pretty much the case in 2012 as well. So I'm going to move on to the next slide to talk a little more about what is medical necessity, since that's the basis of the decision of whether the insurance company is going to cover the treatment or not. So as I'd mentioned, insurance companies are only required to cover treatment that is medically necessary, and insurance companies have their own standards, their own medical necessity criteria that they use to make a decision about whether a particular treatment is medically necessary. So they're, for like different types of behavioral health treatment, say there are medical necessity criteria for inpatient treatment, for outpatient treatment, for residential treatment, and the insurance company will look over the person's medical records and will compare it with the criteria and see, does it match up with that level of care. But when someone appeals the insurance company's claim denial and they go through the Office of Patient Protection, we don't have to follow what the insurance company says are the medical necessity rules. The standard that's used is the state law, and so in Massachusetts we have a state standard for medical necessity, which is healthcare services that are consistent with generally accepted principles of professional medical practice, and that's determined by whether the service is the most appropriate available supply or level of service for the insured in question, considering the potential benefits and harms to the individual. whether the treatment is known to be effective based on scientific evidence, professional standards, and expert opinion in improving health outcomes. And for services and interventions not in widespread use, whether it's based on scientific evidence. So the medical reviewers who we send the cases out to, they review the decision based on this standard that I just described, so they don't have to necessarily follow the insurance company rules about medical necessity. So I'm going to just briefly touch on other health insurance appeal rights that aren't part of the Office of Patient Protection's mandate. So if a person in Massachusetts has a self-insured plan that they have gotten through an employer, so if someone works for a large employer, you know, some examples that I can think of are like Raytheon, Partners Healthcare, IBM, larger companies who use self-insured plans, you still have appeal rights for medical necessity denials. It's regulated by the federal government, not the state. And as long as your plan is not a grandfathered plan under the Affordable Care Act, you would have appeal rights. So what would happen for an individual with a self-insured plan when they get the final adverse determination, they would get information from the insurance company directly about what to do to pursue their appeal rights at that point. And the enforcement agency is the United States Department of Labor, within that the Employee Benefits Security Administration. And so they answer questions and look at compliance for health insurance appeals for self-insured plans. For government employees in Massachusetts, you may have a fully insured plan or a self-insured plan, depending on the kind of coverage that you've elected. Most state employees, I think most of the plans that are offered are self-insured plans. But if you have a fully insured plan as a state employee, then you do have appeal rights through the Office of Patient Protection, a state or municipal employee, I should say. But if your plan is self-insured, then you would have appeal rights that are more similar to the self-insured employer-sponsored plans that I just talked about. And so if you received a denial letter, there would be information in that letter about how to pursue your appeal rights from there. If there was a question about compliance or about the laws, the agency that's in charge of this area is the United States Department of Health and Human Services. And also, I should just note, if you're a federal employee, there's a set of appeal rights through the Office of Personnel Management. If you have Medicaid or Mass Health, then OPP cannot take appeals for Mass Health plans. If you have Mass Health secondary to a commercial insurance plan, then you would still have appeal rights through OPP for decisions made by the fully insured commercial health plan if Mass Health was secondary. But for Mass Health, there's a separate appeals process, and medical necessity issues or appeals would be brought through the Mass Health Board of Hearings. In general, external review decisions are final and binding, although there may be other legal rights available outside of the external review process depending on the type of plan that you have. So I'm going to touch briefly on some issues as they relate to behavioral health. And I should mention mental health and substance use disorder treatment claims are the single largest category of external reviews filed with the Office of Patient Protection. So usually from about 30 to 50% of the appeal requests involve mental health treatment or substance use treatment. And as I mentioned, the external review through the Office of Patient Protection looks at the medical necessity of the treatment. This is different from the next thing I'm going to mention, which is mental health parity complaints. And there are a set of laws that protect consumers who need behavioral health treatment, mental health treatment, or substance abuse treatment, and a set of state and federal laws that require, in most cases, that those claims be treated the same as claims for physical health treatment. But it's not, parity is not something that, it may be related to a claim that goes through the Office of Patient Protection. It might be related to an external review request, but if there's an actual parity complaint, there are different agencies who handle those. So in Massachusetts, if you have a complaint about a fully insured plan, then you would file that complaint with the Division of Insurance if you believed that the mental health parity laws were being violated. And they also have a consumer hotline, and they have a complaint form that's available online. For Mass Health Plan, parity complaints would be addressed to Mass Health, and you could call their customer service department for information about how to pursue that. For self-insured plans, the employer-sponsored self-insured plans, parity complaints could be brought through the Department of Labor, Employee Benefit Security Administration. And for, it's not on the slide, but for the self-insured or fully insured non-federal government plans, so state or municipal government employee plans, that would also go through the United States Health and Human Services Department. And this is just a quick look at the external review requests that we've received in the first half of 2014. So you see that this year nearly half of the external review requests, as usual, relate to behavioral health treatment. So on this next slide is a case example so that I can sort of give you an example of a typical case, and this is not based on any one individual's case. This is sort of just similar to different issues that have come through the Office of Patient Protection. So this is an example for a family who received a denial from an insurance company for coverage of speech therapy for their child. So the child in the example, Sophia, is a 4-year-old girl recently diagnosed with autism, and her commercial insurance company has, let's say, agreed to pay for her ABA therapy, her applied behavioral analysis therapy, but in another request for authorization for speech therapy, the insurance company denied it because the insurance company determined that in her case it's not medically necessary. So Sophia's family can appeal the insurance company denial of the speech therapy, and they would start out the process at the internal review level. So they would start by filing a member grievance, and you would do that either in writing with the insurance company directly or over the phone, and the insurance company would then put that grievance in writing and send you a copy. And then the insurance company, unless it's an urgent matter, they would have 30 days to make that a decision on the grievance. So the insurance company would review the member grievance, and if they reviewed it and still declined to pay, then depending on what type of insurance they have, Sophia's family may be eligible to file an external review request with the Office of Patient Protection. So how would they know this? They would receive a final adverse determination letter, that denial letter, from the insurance company saying, we considered your grievance that you filed and we've determined that treatment's not medically necessary and it won't be covered under your insurance plan, and there should be information in that letter about appeal rights. So if it's the type of plan where you could appeal through the Office of Patient Protection, there will be contact information for the Office of Patient Protection, our 800 number and our address. And the insurance company will also include a copy of the form that you use to file an external review request with the Office of Patient Protection. If for some reason there is not a copy of the form, though, it's available on our website. So if the family decides that, yes, this is what they want to do, they want to pursue the next level of appeal, the external review, then they would fill out the external review application form and include copies of the notices that they received from the insurance companies. And they may also decide that they would like to send other information, such as letters from doctors, speech therapists, healthcare providers, daycare providers, or if they have other supplemental information, they could include that as well with the appeal. Oh, I should mention there is a $25 fee to request an external review, although that is waived if the person who's applying states that they have a financial hardship. And also, if you do pay the $25 fee and if you win your case, then the $25 fee is refunded to you. So So what would happen then, the family would send their packet of information, the application, the letters from the insurance company, anything else that they wanted to submit to the Office of Patient Protection. We would review the case and determine if it's eligible. If it is eligible, we would send it to one of the external review agencies that I described earlier. They would assign the case to one of their medical reviewers. You would also receive a letter from us just confirming, yes, we received your case, we've sent it to, we would identify which external review agency we sent it to and let you know how to send supplemental information. If you filed a standard appeal, you have an additional 10 days to submit further information if there's something new that's come up or something else that the consumer wants to submit as part of the appeal. So the external review agency assigns the case to one of their providers. Let's say it may be a speech therapist or a developmental pediatrician, depending on the case, and they would make the decision. The reviewer would write a decision saying that, yes, it is medically necessary, or no, it's not, and explaining the reasons why. And the person who filed the appeal would get a copy of that in the mail. You also can, if you want, you can designate someone else to be your appeals representative. So sometimes people will designate a family member or a healthcare provider, or in some instances an attorney, although you don't need an attorney. So if there was a representative helping with the case, they would get a copy of the decision as well. And if the external review agency had decided here that for Sophia speech therapy is medically necessary, then the insurance company would have to pay for the therapy. And the insurance company would respond to the family within 5 days of receiving the decision and would comply with the decision without delay. If there was anything else that the insurance company needed, such as additional forms or any other steps that the family had to take, then they would notify the family in that letter that's sent within 5 days. So I'll pause there for just a second. Are there any questions at this point about health insurance appeal rights? You can also feel free to type in questions as they may come up, or ask questions at the end as well. Okay, so I'm sure that's all 100% perfectly clear. I'm going to move on to insurance enrollment waivers now. And this is a relatively newer duty of the Office of Patient Protection, and this was a duty that was added as part of Massachusetts health reform. So I guess I'll back up a little bit. So if you don't have insurance through an employer, or if for some reason you just want to purchase your own insurance either through the health connector or directly from an insurance carrier, that's called non-group insurance. The group would be your employer and the employees, but if you buy non-group insurance, you're just buying the insurance directly. And there are certain periods of time that are open enrollment periods, and those are set by state and federal law. So during an open enrollment period, pretty much any Massachusetts resident can either approach the health connector or an insurance company directly to purchase non-group health insurance. And the open enrollment date earlier this year was January 1st through March 31st, and then the next open enrollment period that's coming up is scheduled for November 15th, 2014 through February 15th, 2015. So during those periods of time, if you need to buy insurance, you're all set. If you want to buy insurance when enrollment is closed, then typically you should be all set as well if you have what's called a qualifying event, or if a special enrollment period applies to you. So that is, well, I guess the first one I'll talk about is if you're eligible for subsidized insurance, so if your income is at or below 300% of the federal poverty level, if you, say, used to qualify for Commonwealth care, or if you qualify for Mass Health, or if your income is close to that level, then the open enrollment rules don't even apply to you. Actually, you can just purchase insurance at any point in the year. So this is not a concern for that group of people. But if your income is above 300% of the federal poverty level, then the enrollment rules around open enrollment will apply. But you can buy nearly at any time if you recently lost your insurance coverage, usually within the past 60 or 63 days, depending on the reason that you lost insurance. So for an individual who just lost their job, or maybe who had insurance through a spouse but has divorced and is not going to continue the insurance, or if you work for a company that is closed, or some other reason for losing insurance, generally within 60 days if you purchase insurance, you can just go ahead and buy insurance, and you'll be found to have a qualifying event. Another group that does not have to be concerned about the open enrollment periods is if you're a small business owner and you're buying insurance for your business. Most small businesses can purchase insurance through the Health Connectors Business Express program without having to purchase during those open enrollment periods. But let's say you missed open enrollment and you missed the 60 days or 63 days window for buying insurance, and you realize, oh, now I don't have insurance and I really meant to. You may be eligible for an enrollment waiver in Massachusetts to buy insurance if you did not intentionally forgo enrollment in a health insurance plan. And so some examples of the group of people who may be eligible for enrollment waiver is if someone applied for Mass Health or other subsidized coverage and did not receive an answer for for a long enough period of time that they missed their 63-day window, or if someone lost coverage but did not find out until after 63 days had passed. So there have been instances of that happening where an employer might be failing to pay the premiums or something like that, and the employees might not get notice until too late. So in those cases, if a person wants to buy insurance, the first step to sign up for insurance and to apply for a waiver is you have to go and try to buy the non-group insurance. So even if you think you're going to be denied, you apply to purchase insurance through the Health Connector or through an insurance company directly or an insurance agent. And the next step then is you'll receive a denial from the insurance company or agent, and that will either be in writing or it may be by email. So you should also at that time receive some information about the Office of Patient Protection and the waiver process, and you would need a copy of that denial notice in order to apply for a waiver. So then once you have a copy of the denial notice, step 3 is you can apply for an enrollment waiver. You would fill out the waiver application, which is available from the insurer. It's also on the Office of Patient Protection website, and you send the completed waiver application and the denial notice to the Office of Patient Protection. So all that we can do at the Office of Patient Protection is give you the waiver saying that you're exempt from the open enrollment period for a certain period of time. So you would take the waiver and go back to the insurance company to buy the insurance. We don't sell insurance. We don't sign people up for insurance. That's not within our jurisdiction. But you would take the waiver and within 30 days go back to the insurer to purchase the insurance that you'd applied for in the first place. So if there are any questions about the enrollment waiver process, I could take those now.
It's not about the waiver process, it's back to appeals.
Okay.
So can you file a new action in court if the appeal fails?
That's a good question and a complicated question. It would generally you may have other legal rights. It's going to depend on the type of insurance plan that you have, and that's not really an assessment that we can make at the Office of Patient Protection. But depending on the plan, you might have rights under federal law, you might have rights under state law, and that's something that you could consult with your own attorney about. Any other questions? Okay. All right. So I'm going to give you some contact information for us and for the other agencies who can be helpful about these matters. Oh, maybe one more question?
Yes, another question. What happens if the insurer did not let you know about the waiver process and 30 days has elapsed?
Okay, so if you applied for insurance and you were denied and missed that window, you could file a new application for insurance and receive another denial and kind of start the process over again and just explain in your waiver application what had happened and why you missed that time period. And I should just note, sometimes people receive a denial letter from an insurance company and it says that you can apply for a waiver or you can submit a certificate of creditable coverage showing that you had insurance within the past 60 days. And those letters, they can be confusing and sometimes people think they need both. You really don't need both, so carefully read any denial letter that you get because you might already have the certificate of creditable coverage. You might be able to go ahead and buy insurance without going through the waiver process. It's not a hugely burdensome process, but it does take some additional time. So feel free to keep asking questions if you think of any, if any come up, and let me give you some contact information for us. So for more information about the Health Policy Commission and the Office of Patient Protection, our web addresses are there, mass.gov/HPC or mass.gov/HPC/OPP. You can follow us on Twitter. We have an email address for the Office of Patient Protection. I would just remind people, though, if you're going to email us information, please do not email confidential health information, just to protect your own confidentiality and security. We do have a fax, and that fax information is on our website if you want to send medical records or something containing confidential or personal information. But certainly general questions or checking on the status of something, feel free to use our email address. There's also a general email address for the Health Policy Commission, so if you're interested in learning more about the Health Policy Commission or getting on our email list for public meetings and reports that we issue, you can sign up through that email address. You can always call the Office of Patient Protection at 800-436-7757, and I should also mention in the past, due to staffing, those calls would go directly to a voicemail box and we would return the calls as soon as we could, but we have additional staff now who is available throughout the day to answer the phone. So if you don't get us right away, please do leave a message, but we do have staff who tries to answer calls as they come in. And if you are interested in contacting the other state or federal agencies that I mentioned, that contact information is on slide 17. So for Division of Insurance, Mass Health, the Massachusetts Health Connector, Office of Attorney General Healthcare Division is here because they have a complaint resolution line where they help consumers to resolve certain healthcare issues. So billing disputes are issues that aren't eligible for the appeals process. Healthcare for All is a good resource for more information about health insurance, and their number is 800-272-4232. And the two federal agencies that handle appeal issues and compliance for self-insured plans are listed here as well, the Department of Labor and Health and Human Services. So thank you very much for participating, and please feel free to reach out to the Office of Patient Protection if you have questions about health insurance appeals.
Thank you.